Project Nirbhaya. Nirbhaya is the one who is not afraid. Nirbhaya is a common platform for vulnerable patients, survivors, doctors, and volunteers to fight against breast cancer. Our motto is to eradicate breast cancer by best use of technology. Our closer interaction with practitioners, survivors, families, volunteers, and fundraisers helped us to group the problems into 4 categories. Societal concern. There's a lack of positive outlook from the society towards victims, survivors, and vulnerable. There's a need for boosting the morale. Financial deficit. Lack of funds and knowledge about the healthcare facilities and insurance is one of the primary reasons for the vulnerable and victims to skip diagnosis and treatment. Information gap. Lack of awareness about the criticality of the disease, ways to diagnose and cure are important reasons for increase in the number of victims and fatality. Technical deficiency. Lack of knowledge about available technical resources and their accessibility is a big factor. Nirbhaya uses cutting-edge technology to build a stable system which equalizes the relationship between stakeholders to build an effective solution. Smart Assist. Smart Assist provides intelligent assistance to doctors to perform accurate diagnosis and take quick treatment decisions. It uses the historical data related to diagnostics and treatment to find the vital points in a mammogram. This helps in grading a tumor as T1, T2, or T3. Additionally, it uses the pathology report to suggest the ideal procedure to combat breast cancer. Smart Feed. Smart Feed shows relevant content to users, delivering relevant inspirational stories to victims, correct information to family and volunteers. A regression model-based recommendation system generates personalized feed and assessments based on the user activities. This engages existing users and also helps in increasing the user base. Smart Radar. Smart Radar finds the high-risk potential regions to promote effective volunteership and organize awareness programs for the needy. It intelligently uses data from demography, user engagement, and healthcare facilities to determine potential regions. User inputs and statistical data of breast cancer patient are used to mark the different risk levels of vulnerable zone. It suggests Smart Conclave for awareness programs and volunteer engagements. Additionally, Smart Radar provides a way to retail connects for contribution in awareness. Smart Conclave. To organize awareness program in the identified regions with available volunteers, Smart Conclave runs on the present data and sends virtual conclave recommendation to users. Virtual conclave recommendations are sent to volunteers for organizing awareness programs in identified regions. These recommendations are generated using input from Smart Radar, user activity, and availability of practitioners and counselors. Smart Scheduler. Automatic scheduling of appointments and awareness conclaves using information from all modules results in higher productivity and lower slippages. Risk assessment results and information from healthcare systems will be aggregated and used to schedule the appointments smartly. Chatbot. Nirbhaya is enabled with an interactive chatbot to help a user from navigating to write content to a conversation filled with positive quotes. And that brings us to the end of our proposal presentation. We have seen how Nirbhaya as a platform prevails over the technical deficiency in the existing system through connecting smart features such as Smart Assist, Smart Scheduler, and Smart Conclave. We have also seen how Nirbhaya as a platform bridges the information gap in the existing system by providing personalized feeds to all stakeholders. Highly interactive chatbot provides support round the clock to all the users. Societal concern is one of the major factors affecting the awareness of breast cancer and its cure. Nirbhaya as a platform overcomes this concern by engaging vulnerable communities with volunteers and ambassadors. Availability of financial support will do away with many underprivileged vulnerable by providing financial assistance. Nirbhaya as a platform allows firms, fundraising bodies, third-party mediators, and healthcare systems to collaborate and provide appropriate financial aid to the needy. It is our strong belief that the proposed solution, Nirbhaya, will improvise the existing ecosystem by creating awareness among the large population and encourage individuals to connect, collaborate, and cure breast cancer. In the end, let us all resonate with what we learned from this line of Roy T. Bennett. Do not fear failure, but rather fear not trying.